Hi everyone, I'm Caitlin Green, and today I'm going to be presenting the teaching strategy of roleplay. I will discuss what roleplay is, the development of roleplay as a teaching strategy, and the process of implementing the strategy. I will also talk about many environments in which roleplay can be applied, as well as the advantages and potential disadvantages of this strategy. I've also included a video clip at the end of the presentation, which demonstrates one nursing program's use of roleplay as a teaching strategy. So what is roleplay? Roleplay is a type of simulation activity involving dramatic technique in which the participants assume the roles of others. Usually it is unscripted, and spontaneous interactions require that participants improvise behaviors that illustrate the expected action of their character role in a defined situation. The strategy involves the audience members as observer participants who provide feedback. Before the scenario is acted out, a briefing or staging occurs, and following the roleplay scenario, analysis and interpretation occurs, referred to as debriefing. Roleplay was developed in response to a need for attitudinal changes in psychotherapy and counseling. It was derived from psychodrama, which is a technique where participants use specific lines and acted as themselves. Roleplay evolved as an educational technique to allow more spontaneous expression of thoughts and feelings in the role of someone else, the person whose part you are playing. Initially, psychotherapists used roleplay to assist patients in clarifying people's behavior toward one another. It was additionally used in sensitivity training. Studies have been conducted on the use of roleplay as a teaching strategy, and reported perceptions of nursing students were that it is stimulating and valuable, and when compared to traditional lecture, it's more likely to increase their learning and what they remember. There are numerous purposes for the use of roleplay as a teaching strategy. Roleplay activities allow students to be creative in exploring many types of scenarios. It can increase their cultural competence, and it can be used to promote team building and skills development. Role-playing can be used to develop communication techniques for use with patients, as well as with colleagues and the interdisciplinary healthcare team. It also allows students to experiment, practice their skills, as well as their decision-making and problem-solving in a safe and risk-free environment. There are 3 steps to the role-playing strategy process. There is planning that must be done before the class session in order to implement role-playing effectively. And as discussed in Bradshaw and Lowenstein, planning is crucial to the effective use of role-play, and it's required not only prior to the class, but also during the actual exercise itself, as some of the experiences may require modifications as they play out. In designing a role-playing exercise, a scenario should be created that contains roles to be played, and this should be outlined to provide a background for the problem situation and any constraints that may apply. And this helps to not only define the important characteristics of the role that will be played, but it also provides a framework for the behaviors and actions to be elicited. It is up to the instructor if they assign the roles or if they instruct the students on how to behave. The instructor should consider that students might be the most comfortable acting out situations they have previously experienced rather than ones that are completely hypothetical, and these realistic situations can provide valuable learning opportunities. The instructor might consider having a test run of the scenario before it's used in the classroom in order to anticipate potential problems and determine if it meets the learning objectives. During the implementation phase of role-playing, the scenario and the character roles must be described to the students with enough information to elicit responses that meet those learning objectives. It is ideal to encourage spontaneity, but students must understand the character roles and their attitudes clearly. As Bradshaw and Lowenstein describe it, students must understand the importance of being spontaneous within the character parameters. The instructor is responsible for ensuring that the stage is set, monitoring the actions, and guiding the analysis of the scenario that's played out. It must be emphasized to students that what the objectives are, the scenario and the characters, and the importance of the role of the observers for the analysis of the role-play scenario. As effective use of role-play focuses on student participation and interaction, the instructor acts as the facilitator, not the director, and guides the experience to meet the learning objectives. Debriefing requires the most time and is the most important phase of role-play. It's a reflective process that follows the role-play scenario, and it involves discussion and analysis, as well as evaluation, and new strategy formation. It can be helpful for students to re-perform the role play scenario after debriefing occurs, as it can give them more confidence in handling the proposed situation. During the debriefing, the instructor again takes a passive role and clarifies and guides the students. Role play is appropriate for a variety of learners, including undergraduates and graduate students. And depending on the learning objectives, the scenarios can be developed with as much complexity or as simply as needed. There are a variety of sensory functions used in role play, which make it an innovative and interactive strategy addressing all four learning preferences. Verbal and nonverbal cues are used. Cognitive processes of interpretation and analyzation are used. Preparation for the roles involves reading and writing skills. And the actual performance of the roles reflects kinesthetic engagement. All of the dimensions of learning are also addressed, including cognitive, affective, psychomotor, and physiological dimensions. Role-playing is also ideal for adult learners as it incorporates a connection to real-life situations and provides active participation. Role-play is not limited to the classroom setting. It can be used in teaching online courses as well. While there isn't any person-to-person drama, the scenario can still be created, parts assigned, and then conversation can be carried out on a discussion board. And this allows students the opportunity of acting rather than just reading and listening online. The role-play strategy in the online setting follows the same major principles as when it's implemented in the classroom setting. In the asynchronous online course, it may take longer to act out the scenario, and the level of spontaneity may be less, but it's still shown to be an effective strategy. In the synchronous environment, the dialogue will more closely mimic an actual conversation. Overall, the design of the role play will still depend on the learning objectives that have been established. There are a couple of alternative role play strategies that do not require student interaction with other students. For instance, simulation computers can be used, where the computer acts as the voice for the patient, and this can sometimes allow better assessment of patient responses with issues like pain or anxiety. Also, simulation mannequins can be used, and these provide role play opportunities where the mannequin provides the physiological issues and the student acts in the human role, such as the nurse, the doctor, or the family member. And these types of role play strategies require that students react to those complex situations while providing care to simulated patients in realistic environments. According to Bradshaw and Lowenstein, one of the advantages of the role play strategy is that the length of the role play exercise does not matter. Regardless, the development of communicative competence will still result, as students must work together in exchanging information, and the audience will provide feedback regarding the success of their adoption of cultural roles and their expression of opinions. Role play has been shown to be effective, especially for the development of decision-making and problem-solving skills. And some additional advantages include enhanced observation skills and the comprehension of complex behaviors. Role-playing provides students with immediate feedback regarding their success in using these skills, as well as their decision-making and problem-solving. And ultimately, students are able to practice all of the skills and address what might be complex scenarios in a safe and risk-free environment. Despite the numerous advantages used with role-playing, there are several potential disadvantages that may be realized. Stereotyping might occur with the presentation of the roles as a reflection of the values and expectations of either the student or the teacher. And this is an undesirable behavior because it may reinforce prejudices or preconceptions. So when debriefing occurs after role-play scenarios, students should be encouraged to question or challenge any assumptions they feel may have been made. Another problem that can arise is the inability for students to separate the role presented in the role-playing scenario versus the student playing the role. Observers are not critiquing the student, they are critiquing the behaviors of the character that was played. An additional consideration is making sure that the learning environment is arranged so that everyone is participating, including the audience members. They need to be able to see and hear everything that is happening. The role-play scenario requires the full attention of everyone involved, and learning environments where students might be trying to multitask are unlikely successful for role-play. Students may be shy, they might have stage fright, or they might have another reason they do not want to participate in role-playing scenarios. So they should be reminded that it's not a test of their acting ability, but if the role-play scenario is not appearing to move in a successful direction, the instructor should consider using a different strategy. Role-playing is definitely a time-consuming method for faculty with all the planning that goes into it, and educators who like to be in control of the learning environment may find it to be a frustrating teaching strategy. There are several teaching tips as discussed in Billings and Halstead that will aid the instructor in the utilization of role-play as a teaching strategy. In addition to planning the role-play scenario, the educator must be prepared to monitor and modify the scenario as it progresses when it's acted out, based on the student actions and reactions, and there may need to be some redirecting. The educator should consider that situations which involve conflicting emotions provide really good scenarios for role-play. As debriefing is the most important stage of role-play, the educator should make sure that there's adequate time, and students need to be able to clarify their actions and decisions. Observational skills can be enhanced, and other interpersonal reactions can be anticipated. Videotaping and audio taping may be beneficial and aid in the debriefing process. However, it may be something that students are less willing to participate in role-play with because they might be more self-conscious about being taped and therefore inhibit their performance. The role-play teaching strategy works best with small groups of students, and those that are not performing in the roles serve as active observers. The educator should encourage students involved in the roles to respond naturally to the situations and avoid phony acting. And the criticism that occurs should again be directed at the behaviors that were exhibited in the role-play, not directed towards the specific students. In Bradshaw and Lowenstein, there is a discussion of a study which looked at nursing students who role-played with theater students versus role-playing with other nursing students. The study found that the nursing students who engaged with the theater students, as opposed to their peers, had increased confidence in their approach to patients as well as with interdisciplinary colleagues. This was due to the fact that in role-playing with other nursing students, they were being inadvertently assisted, which interfered with their ability to gain confidence. And this is something that the educator should be aware of in using role-play as a teaching strategy. The clip included on this slide is from YouTube, and it was created by the University of Hawaii, and it shows examples of role-play as a mutually beneficial teaching strategy using students from the theater department as patients, while the nursing students act in the role of the nurse. You'll have to click the link to access the video, as I was unable to get it to play from the slide here, but go ahead and watch it, and then you can resume the presentation. As nurse educators, our primary concern will be to enable our students to become competent nurses, able to address patient and family members' needs in a safe and appropriate manner. We will need to promote innovative teaching strategies in order to ensure that students can appreciate the feelings of the patient and how to respond in multiple situations, some of which may be uncomfortable. By using role-play as a teaching strategy, nursing students can experience multiple roles in real-life scenarios, enhance critical thinking and skills development, and they'll be able to apply these in their future practice. These are the references that I used in the creation of this presentation. Thanks for watching. If there are any questions, please post them in the discussion board and I will be happy to answer them.